Hi, my name is Ed, and I'm gonna be showing you how to do a central venous access dressing change today. Okay, just a disclaimer. I've already like used up all my dressing, like the transparent dressing. So as of this moment, I'm just gonna be more verbalize what I'm gonna be doing. Okay, when I get into my patient's room, I want to make sure I do my OE wipes. Um, I got the order right here in the computer, my doctor's order for a dressing change, and I've got all my supplies. It's already on um, the table on the side of the bed of my patient, and I'm just gonna perform some hygiene, provide privacy, perform some hand hygiene. And I want to make sure I confirm my patient by looking at the chart and the order and asking my patients for two identifiers. Um, Sir, can you tell me your name and your date of birth, please? Okay, Mr. Smith, thank you very much. Okay, can I ask you if you have any allergies that you know of, like any allergies to any medication, any allergies to any cleaning solution, or allergies to latex? Or any environmental allergies as well? No? Okay, thank you very much, sir. Okay, today we're gonna be doing a dressing change on your central line. Is that gonna be okay? Okay, because I know it's been a couple of days since the last dressing change, so I wanna make sure we keep it clean and good, okay? Okay, I wanna make sure when we do the dressing change later, I'm gonna ask you to turn away your head to the other side, away from the dressing, we're gonna be doing the procedure from your central line, just to make sure we don't run the risk of having any respiratory contamination on the line, okay? All right, thank you very much. All right, at this point in time, I'm gonna go ahead and bring my patient's bed up to good working level on my end, and at the same time I'm gonna have my patient lie on his back in a supine position, just to make sure by lying in the supine position we're reducing the risk of any air embolism as well. So my patient has his central line on his left arm. I'm gonna go ahead and ask him to just raise his arm where the central line is. Okay, thank you very much, sir. At this point in time, I'm now ready to take the old dressing and then start the dressing change. Okay, if the patient cannot move his head on the other side, we can also have him wear a mask. Okay, thank you very much. Now I'm ready to open my dressing kit. Before I open my dressing kit, I want to make sure I check the contents inside, the list of contents inside. I'll make sure I have everything that I'm going to be using. And when I open it, making sure I don't touch the inside because it's a sterile kit. Once it's open, I'm just going to take carefully the mask out that I'm going to be using. After that, I'm gonna perform hand hygiene again just to make sure, and I'm gonna put on some regular gloves. Before I go and take the old dressing out, I want to make sure I inspect um, the insertion site, checking for any tenderness or any swelling or redness. If there is none, then I'm gonna go ahead and take the dressing out. Since it's a transparent dressing, I'm just gonna go ahead and take it out by pulling it outwards. I am just gonna pretend as if I'm taking out the dressing because I ran out of dressing already. I'm sorry, Professor Pippin. Okay, at this point in time, um, I've taken out the transparent dressing already. I'm just gonna dump it in a proper bin, a receptacle. If the patient has a secure lock device and an antimicrobial patch, this is also the good time to take it out. But before you take it out, make sure you wipe the side of the device, the secure lock device, with alcohol, and then you gently take it out. After you've taken all the dressing out, you want to make sure you assess the skin on the side again, checking for any redness, swelling, any drainage, and any tenderness or any foul odor as well. Then if there is none, then we're now ready to clean the insertion site. Before you clean it, you can also check and assess or measure the length of the catheter. You make sure you document it, and then you compare it to the previously documented measurement just to make sure we see if there's any migration of the catheter into the veins or in the skin. At this point in time, I've taken my regular gloves out. I'm gonna go ahead and put on my sterile gloves. Just carefully take it out of the sterile kit. With my non-dominant hand earlier, I took it from the inside. Now with my dominant hand, after putting on the gloves, I took it from the outside. At this point in time, now I'm ready to clean the insertion site. First, I'm gonna clean it with an alcohol swab sticks. I'm gonna clean the site, and I'm gonna go ahead and clean under the line as well. And I'm gonna clean it in a circular motion from the inside out. Once it's done, you make sure you dump the cotton or the swab stick on the receptacle, and then you let it dry for 30 seconds, and then after that you're gonna go ahead, and if you have a betadine or povidone iodine, you're gonna go ahead and put some iodine on it as well. In the same manner, you're gonna go ahead in a circular motion under the line from the inside out. And you can also put some iodine on top of the line just to where you're gonna be covering it with the dressing. After that, you're gonna let it dry for 30 seconds again. And then at this point in time, before we put the dressing, the transparent dressing, you want to make sure you wipe the edges where you're gonna be putting the dressing with the skin prep, just to make sure the dressing sticks in there and doesn't go off. So I pretend I opened the skin prep, and then I just wiped on the sides, the edges. And then at this point in time, if you have the secure lock again, if you have a new one, then you can go and touch it. Or if you have an antimicrobial patch, you can go ahead and touch it to hold the catheter in place. And then after that, now we're ready to put our transparent dressing. Just to make sure you don't cover the whole catheter, leaving um, the end of the catheter, just to make sure you can gain an access if you need it. Alright, after that, you might want to just take a look on the side and check for any irregularities, tenderness, swelling. If there's none, and now you can take your gloves off. And put it in the receptacle and do some hand hygiene. At this point in time, you can gather all the supplies that you used and dump them in the proper receptacle. And of course, do hand hygiene again, just to make sure you keep your hands clean and not contaminated. And then you're gonna make sure you ask your patient if he's fine, how he tolerated the procedure, and if it's okay, then you can put him back in a safe position, all the bed down, all the way down, collect button within reach. If he has any personal items that he wants to be by his side, you can give it to him as well. And you can ask him how he's feeling, how after the dressing change. So you will know how he tolerated the dressing change as well. So at this point in time, you're now ready to do your documentation. Now, when you're documenting, you want to make sure you put in your documentation the assessment of the catheter site before you change it, and after you change it. You also want to make sure you put in there the length, or when you measure the length of the catheter, just to make sure it can be compared from the previously documented length to see if there's any migration. You also want to make sure you document the condition of the insertion site, the condition of the dressing, especially the previous dressing. You also want to make sure you put in there the dressing type that you put or you applied, and of course how the patient tolerated the procedure. So if everything is done, and then you can perform your hand hygiene, open the curtain back and make sure that the patient is good and all right, and make sure you go and reassess the patient after like an hour or 30 minutes before your shift ends. Thank you very much, and I hope you enjoyed my video today, and you have a good night.